vivid memories from when I was at school about being told off for getting my affect and effect the wrong way round. Now I'm obviously no longer in primary school. I do know the difference between the effect, which is occurring as an endpoint and therefore is often a noun. For example, patients have side effects to medications, and the affect, which is an action and therefore is often a verb. Everyone is going to be affected by the changes to medication availability. However, imagine my distress when at medical school they muddied the waters a little bit by telling us that in the mental state examination we're going to be assessing a patient's affect, which is the external display of a patient's mood. Yeah, okay. So what actually is an affect with regard to a mental state examination? So an affect can be facial, it can be tone, and it can also be bodily in terms of activity. And we can have a blunted affect, a negative affect, an inappropriate affect, and a labile affect. So as an example, a labile affect, it appears that the emotions that they appear to be exhibiting are changing very rapidly without obvious reason for that. We can have a blunted affect where everything is just slightly less than we'd expect it to be. So for example, a patient saying, yeah, my child's died. I mean, it's really bad, but I have to get over these things. I've lost my house. It's a pain in the neck. We'll get through these things. It's just not what you'd expect given the gravity of what they're talking about. Conversely, there is the inappropriate affect. So often things have a discordance. So for example, I'm over the moon. I won the lottery. I've not got any money worries. Life is going to have changed beyond my wildest dreams. Really couldn't be happier. It's very much not in keeping with what we'd expect the patient to be experiencing from a mood that they appear to be talking about. We've got obviously our normal affect where the patient is sad. They're saying they're sad. They look sad. They're crying. Their tone is reduced. Things appear to be doing as they should do. Ultimately, affect is going to be a crucial part of your examination because it's how you are assessing the way the patient is appearing. Take care. We'll see you in the next one. Cheerio.